looking at coronaries, when we look at chronic total occlusions, probably the most challenging thing that an interventional cardiologist does. And for me, what I'm looking at is I need a better visual or better imaging technique to provide me with a pathway of where I'm headed. Because when a blockage is 100%, you may not find the channel. You may end up in non-channel areas. And though that's where I think I'm looking forward to better imaging techniques, and I'm really noticing and seeing companies investing a lot of money in trying to find us better tools for treatment of these patients. The other trends of treatment are mostly for heart valves, and we're seeing a lot of new technology coming through. Valves that are repositionable, meaning even after you deploy most of the heart valve, if you do not appreciate or like the way that it's being deployed, you can actually pull it back and then redeploy. And that's something I think is some of the valves already have it, but not to the degree where we would like it. And I think that's the one of new pipeline products by multiple companies. And I think Medtronic and St. Jude and Edwards are all looking to find ways, and Boston Scientific, every company has their own pipeline product, which are very exciting to really look at. I think a lot of new pipeline products for pulmonary embolism treatment, not traditionally a cardiology world, but I think because it's a catheter-based technique, I think cardiologists are going to get involved, and I think we are. Looking at different companies where they are actually proceeding with finding catheters that are large suction-based catheters, where you don't have to necessarily do any type of open heart surgery to go in and try to take out the clot. This is one mechanism where going from the leg, going up to the heart and trying to suction out clot is a great mechanism. Companies like Penumbra, companies like Inari are multiple companies that I'm really watching how they're developing their products. And a lot of these products developed actually from stroke interventions and now towards the heart as well. And speaking about trends regarding stroke intervention, and that's something I think that even though cardiologists have not been traditionally involved, but I think we have the infrastructure for involvement because we have the call schedules, we have the catheter skills, we have the wire skills, and I think getting involved in acute stroke interventions, I think is very exciting. And that's something that personally I'm very interested in for the future in the next 5 to 10 years. At least 3 major studies in the past 2 years have shown that the traditional mechanism of giving full dose TPA or clot busting medication may not necessarily be the best mechanism. Maybe we can do better. Maybe we can actually go in and suck out that clot that actually is causing that stroke. And that's something that I'm truly watching at this point. And hopefully there will be some mechanism of us getting involved as well.